Hi, everyone. Welcome to our weekly Facebook Live. I'm Caitlin Engel, and I'm a registered dietitian and also NKF's Program Development Director. Today, I'm joined by Dr. Sumeska Thavarajah, a nephrologist and assistant professor at the Johns Hopkins University School of Medicine. Dr. Thavarajah, thank you so much for joining us today and providing us with some updates and considerations for people with kidney disease regarding COVID-19.
Thank you for having me. I'm excited to participate today.
Yeah, great. So today we are coming at you both via a webinar. So there's some people joined directly on the Zoom webinar, as well as broadcasting via Facebook Live. So for our participants, wherever you're watching, whether it's on the webinar or on Facebook, please submit your questions to us. You can either do it in the Facebook comments or using the Q&A feature on the Zoom webinar. I will be helping Dr. Thavarajah answer these questions, or I'll be asking them to her. And we're going to hopefully get to all the questions today. But if we don't, we will reply back to you with answers as soon as possible. So Dr. Thavarajah, let's get right into this. COVID-19 is having a huge impact on us all, and especially on people living with kidney disease. Kidney patients might be experiencing some changes in their care. Can you talk with us about what you're seeing and why these changes are happening?
Yeah, it's a little bit scary because there's so many changes happening. One of the big changes are that we're trying to minimize the amount of visits that are happening in our offices. And so we're starting to use a lot of telehealth or telemedicine, where we're doing the visits via phone or via internet connection. And so that can be a little bit scary for patients because they're concerned that maybe they're not getting their points across, maybe they're worried that if the doctor doesn't see them in person, that they're not going to get everything that they need. I always tell people to plan for a telehealth visit just like they plan for their routine doctor's appointment. If there's certain areas of concern that you have, if there's certain areas of questions, write them down. And that appointment time is your time to discuss those issues. And we're doing this sort of as a stopgap, only to make sure that we really minimize how many times people are having to go out, them safe as possible. And the NKF has a great handout or guidelines on telehealth to kind of help you prepare for the appointment, to make sure that you're getting all of the things that you need. But be assured that if you really need to be seen by the doctor or seen in the clinic, they're going to make those arrangements for you. The other big changes we're seeing are for some of our transplant patients or potential transplant recipients. A lot of live donor surgeries are sort of been paused. Now, there's not any additional risk to the donor if they donate a kidney for getting COVID-19, but we do want to make sure people are safe as possible. In certain areas of the country, certain hospital systems are seeing a lot more cases. So you're seeing a lot of pause on these cases, mainly to try and keep everyone safe. And also, if there are concerns about having enough equipment, having enough protective gear, we're going to be, kind of spacing out those elective procedures. We understand that people are anxious, they want to get their procedures done, they want to get that kidney transplant done, but we also want to make sure we're doing it in the safest way possible. The other big change we're seeing is in the dialysis units. I think our dialysis patients have seen a difference in how they come into the unit. From the moment they enter, they get their temperature checked, they are screened for any symptoms, they're given a mask, and the entire staff is masked and wearing protective gear for the entire treatment. So it's a little bit different for them because there's not as much of the community feeling. We've closed the waiting room. We aren't having any sort of open houses. We're not having any of those sort of face-to-face education sessions. So individuals are perhaps feeling a little more isolated than they normally would because they're used to sort of having that routine to them. We're doing all of these things to try and keep people as safe as possible and to really minimize the chance of infection. People with kidney disease are a little bit higher risk of having infections just because they're relatively immunosuppressed. They're coming to a healthcare organization 3 times a week. So we're trying to make that as safe as possible. And, believe us that as a nephrologist and my dialysis team, this is not the level of separation we would like, but these are things that we have to do right now. Now, you also might see your dialysis physician doing telehealth visits. We've had that as a backup plan in case, as healthcare workers, we are told to isolate at home or quarantine at home because of an exposure. This way we could still continue care.
Makes sense. That's really helpful. So you're seeing these kidney patients all day long, and you're probably getting asked a lot of questions. Are there any specific questions that you're hearing often that might be sort of myths or misconceptions that you would maybe want to kind of bust for us here today?
I think one of the challenges is we don't have a lot of previous information about this. So we're all kind of learning as we go. And there are a lot of different sources of information. So we're trying to point people to more health-related websites, government ways to get their information. But some big ones we've seen are people feeling like certain areas of the country are not affected, or certain communities or zip codes. Yes, we might see a difference in the amount of cases in one zip code versus the other, but that might be because we're behind on screening, or there's some lag in the testing. So it may not necessarily be really a difference in that. And so people really have to consider that everyone is at risk because this is a new virus. We haven't been exposed to this before. If somebody has kidney issues, their immune system doesn't respond the same way, or they might be on medications that don't allow their immune system to respond. So they're a little more higher risk. So that's one of the big myths. The other is that we already have a vaccine. The vaccines are things that there's a lot of work being done, but we don't yet have a vaccination for this. So at this point, it's really trying to aim for prevention more than anything else. Another myth or another question that I get quite a bit is there's already an active treatment for it, or already a prescribed treatment. There are a lot of studies occurring at many different hospitals and institutions of different things to try in the setting of this virus, but nothing yet has a proven treatment. And really, people shouldn't take it upon themselves to go ahead and sort of self-treat. Also, all of the trials that are going on are focused on treatment. They're not on prevention things. So taking these medications that may have been mentioned, like hydroxychloroquine or any of those things, are not there to prevent the infection. So, and we can see some complications. We're starting to see some information from other countries, sites where they've actually run into more complications from some of the trials of medications. And it seems like individuals with heart disease might be a little more higher risk from some of these treatments. So this is all still, unfortunately, up in the air. So there's not anything that we can promote or say that this is the way to treat this. And we want to try and keep people as safe as possible. If there's a question about it, they should be asking their physician who's taking care of them in terms of what is the best treatment for them. Another common thing that I've been asked about is whether or not someone is going to get infected again. If they've had a disinfection, are they at risk of getting infected again? We're hoping that that won't be the case, that you may have built up some immunity since that exposure, but we're not sure yet. We are currently developing in the healthcare community and the different institutions, antibody tests that will talk about exposure, but we're not sure yet, does that mean you have enough antibodies to protect you from reinfections? So in the midst of this, we're still telling people, even once may have had the infection and recuperated, to still practice the social distancing, still practice the hand hygiene, and then still keep in contact with their physicians and primary care physicians.
Yeah, all that uncertainty and just the fact that this is so new makes it really challenging. So this is all really helpful. Would you be able to talk with us a little bit about some of the things the National Kidney Foundation has been doing to ensure safety of people living with kidney disease?
So they've approached it on a couple of different fronts. And First of all, the National Kidney Foundation is really focused on patient education and patient advocacy. And so there are several resources on their COVID-19 page, which will help you with diet, which will help you with guidelines about going to dialysis or not going to dialysis, how to manage your transplant, how to manage the social distancing, and some of the best practices in terms of helping prevent infection. Additionally, there are a lot of challenges that have developed in the setting of having this COVID-19. There are issues with people losing their jobs, people not getting a paycheck. So there are some new challenges in terms of perhaps not having the insurance coverage, not having the funding. So there are additional social work resources and guidelines for perhaps applying for gap insurance or gap payment to help them with rent, mortgage, those kinds of things, or give them some guidelines as to how to approach that. There's also information about sort of promoting the home dialysis front. One of the things is, while we are very grateful for having our in-center dialysis, we also want to continue to promote the home dialysis where people that option for doing dialysis treatments in their home setting and perhaps reducing their risk of infection in that sense too. The other advocacy piece has also been trying to address some of the fears about COVID-19 in terms of and making sure that we're advocating for all patients to continue to get the treatment that they need. That if they're a dialysis patient and maybe they're waiting for their testing of about COVID-19, that they still have a place to get their dialysis, that they're still getting their dialysis treatments. And advocacy is consistent with what the NKF has been doing over the years.
Thanks for sharing all of that. I know we're doing a lot, so it's hard to keep track of everything, but I appreciate you updating people on what's going on. Now I think we'll turn it over to our questions from our viewers.
Okay.
A question we've gotten a couple of times from different people is regarding people who are transplant recipients who are immunosuppressed, but might be living with a healthcare provider that is working on the front lines or might be getting exposed to COVID patients. What recommendations would you give those people as far as how to protect themselves at home?
It is a little challenging because there are no official recommendations. We've leaned towards our patients that are on immunosuppression, such as our transplant recipients, really minimizing their contact with other individuals. A little more challenging when it's a family member. If we can help them minimize the amount of exposure, maybe have that healthcare worker stay in a specific part of the house. When they come in the door, make sure that they change out of their scrubs, go grab a shower, really kind of monitor how much exposure that they're having. I mean, someone who is in the ER is probably getting potentially a lot more exposure than somebody who has the benefit of knowing if someone's positive or negative has already been tested. There are a lot of different people coming up with a lot of different ideas. One of the ones I've seen is that actually some healthcare workers have started renting out RVs or borrowing RVs and are actually parking them in their driveway and they're staying in their RV. That way they're on still their home, but they're not running the risk of potentially exposing family members.
Yeah, it's such a challenge for those healthcare workers. I really feel for them and their families. Another question that we just got through the webinar here is there an increased risk of COVID-19 complications in dialysis and transplant patients? Are people with lower kidney functions, so maybe those who aren't yet on dialysis, more likely to face complications?
Well, one of the things is when somebody has advanced kidney disease, or if somebody's on dialysis or is on immunosuppression, their immune system is not going to be able to fight off infection as great. So there is some increased risk of complications. On the flip side, there are still individuals on dialysis who have been tested for COVID-19 who are otherwise asymptomatic. So kind of like for the general population where we're seeing a wide spectrum of cases. Somebody who's very immunosuppressed, such as a transplant recipient, probably is having a little more challenges in terms of getting through this infection and potentially applications that way.
Great, that's really helpful. Lisa on Facebook asked about, and you may not know the answer to this because I realize it's national, but do you know of any transplant patients that have gotten COVID-19 and have these patients recovered?
I can't give you specific numbers. I can give you there are transplant recipients who have been infected with COVID-19 and have recuperated from this.
Mm-hmm.
I know our transplant colleagues are looking at these cases of individuals, seeing sort of what the best practices are and trying to figure out what might be some of the steps moving forward.
Mm-hmm. Thanks. Yeah. So David on our webinar is asking about the unfortunate shortage of masks, and if you can talk at all about how what's being done to ensure that patients are able to be provided with masks.
So I think probably he might be talking about specifically the dialysis units. I can talk about on different levels. From the dialysis unit standpoint, the dialysis units have worked towards making sure that they have a good supply of masks and have very specific guidelines in terms of how they're using them. Individuals can be using a cloth mask when they're going to the grocery store, when they're going out, but they are asking them to change to a surgical mask once they enter the unit. Plus, we're not having them wear that cloth mask in the unit because we don't really be carrying any of those things. In terms of, and then there have been sort of these guidelines in terms of when to throw out the masks, how often to do that, all of those kinds of things in an effort to try and conserve that. That supply, but it is a challenge that every healthcare institution is dealing with. But I know it's, the dialysis units did kind of sort of step forward and start using masks in general for our dialysis patients during the treatments, really before a lot of the national statements or recommendations had come out.
Yeah, it sounds like everyone's trying to make the best of this really difficult situation and make the best choices they can to keep patients healthy. So another question that came through on Facebook is from Adele, and she wants to know about, can cigarette smoke carry COVID-19 or transmit it at all? Is there any information on that?
Not specifically the smoke. There's not any information on that. It's more, it's carried in more, it's a airborne droplet transmission. And so if somebody, say, was smoking and then started to cough, whatever they're coughing out would be potentially carrying the thing, but not specifically any information to say the cigarette smoke someone's blowing out would be carrying that. But it is possible that you have some respiratory droplets in there. So it's more someone's own secretions, respiratory droplets, those kinds of things.
That makes sense. How about for another question coming on the webinar from David is, he says that he's on home dialysis, and this is probably similar for a lot of people, and his spouse will be returning to work once, I assume once their stay-at-home order is lifted, and he wants to know if he should, again, kind of be quarantined, or what your recommendation would be for a spouse that's maybe working outside the home and potentially putting the dialysis patient at risk.
I think one of the things is sort of depending on where they're working or what sort of that work situation is. If they are in a environment where they are in a large group of people, there's potentially a little more risk of, infection from that. If they are someone who's working in the healthcare industry, where they're working in a hospital setting, that definitely would increase the risk of infection there. I think, letting probably employers know that, they have a family member who is somewhat immunocompromised because of their health condition, and they're trying to minimize that, risk of bringing something home, or are things to kind of share with the employers. Some of the other key things that we tell our healthcare workers, when you come in the door, you're changing out of those clothes, you're going to shower, you're making sure you're taking off your shoes, all of those kinds of things, just to minimize what you're carrying into the home. And then while you're at work, really practicing good hand hygiene, wearing, the cloth mask. Just once they lift the stay-at-home orders, probably wearing the masking is probably going to be at least helpful in the sense that at least you wouldn't be spreading whatever germs or bacteria you might be carrying to others.
Yeah, that makes sense. Just being as cautious as possible. I'm seeing a couple questions, one from someone on the webinar, but I've also been seeing comments on our Facebook about transplants being an elective procedure, and especially living donor transplants. And I know we've talked about this in the past, but do you want to touch on that? I realize it's kind of varying across the country, but explaining a little bit what's going on with living donor transplants.
Yeah, so some of them are being paused right now, and some of it is really area dependent. If area is particularly getting hit hard, where the hospitals are having very high rates of COVID-19, where their resources are limited, those types of surgeries are being put on hold because when somebody comes in for a live donor transplant, they are going to be started on immunosuppression. Our goal is always to make sure that, someone's not going to be put at more risk by doing something. And so some areas of the country have continued forward with that. And it's really going to be sort of area dependent, depending on what's happening in terms of their resources and how safe they are. There is some thought with the antibody testing, with some additional screening, with the increased availability of testing, some of these elective surgeries are going to start moving forward because they'll make screening for COVID-19 as part of the pre-op process. I know it's very frustrating, especially if you completed your workup, you're ready to go, you have a potential donor. Everything that people are doing is erring on the side of caution, because the last thing they want to do is bring you into a situation where you could have a COVID-19 exposure or not have the resources you need because they're getting so overwhelmed. Right now in some hospitals, the ICUs are very full. Places that we usually would use, some hospitals have turned their pre-op area, their post-op area into extensions of the ICU. So they really even have a recovery space. They don't have a thing. And so that's where some of those decisions are being made.
Yeah, it's really challenging. I feel for our healthcare providers and hospital systems that are having to make some really, really tough decisions right now. But I appreciate you saying to people that, they're making these decisions with the best interests of the patients in mind, even though I'm sure it's really difficult to be going through this as a patient. Yeah. So I did see a question in our webinar that I think might be really helpful to answer is question about, does Medicaid and Medicare pay for COVID treatment? And you could also touch on, I think, private insurance is kind of what you're seeing.
Specifically in terms of specific insurances, I don't have that answer. Most of them are paying for the treatments. We're not seeing that kind of pushback. Plus, I know on a state-by-state basis, a lot of governors and of the legislation that's going through is about pushing for those treatments to be covered as well.
That's good to know. And certainly people should contact their individual insurance companies, but I hope no one has to worry about getting treatment for this if they're worried about being able to pay for it. So I'm just scrolling through Facebook to see if there's other questions. Questions about transplant recipients going back to work. What would you recommend for those patients who are recipients? Should they try to work from home if they can, or when will it be safe for them to go back to work or kind of go back to more of their regular lives?
So I think a general consensus has been that if there's a potential to work from home, to opt for that. and if there's not, to see what their day-to-day work routine includes, and are there things that are going to put them at more risk, you know? And in terms of when are things going to get back to the usual, right now, no one has a great crystal ball for that. These are decisions that are sort of ongoing and being made based on what information we're getting, what the rate of cases are. And, you know, I know that probably causes a lot more anxiety for people because we just don't have a solid answer. But, you know, for now we're saying, if possible, work from home. If that's a possibility, really kind of looking and seeing what steps are going to be at increased risk. You know, is there a way that you can at least work in a space where you're not having a lot of contact with people? You know, you can have a private office, you know, those kinds of types of things. But we also know the challenges that there are some jobs that do not have some of those things, and, you know, and individuals have competing, you know, financial needs and things like that. So we, you know, try to see what are the best accommodations we can make for someone.
Do you think that those people, like transplant recipients or kidney patients, should they plan to like work from home and kind of do the social distancing until there's a vaccine? Or do you know, will we have a better sense over the coming months as treatments become more available, what those recommendations will be?
I think there's not a real good answer right now. I think as the upcoming months come through and we see where we are with the antibody testing and be able to correlate, what does that antibody testing mean? Does it actually mean that you have you know, what level is protective or not? I think those are the next steps to kind of look for that. The ability to actually more rapidly test people, to also be able to test those individuals with very mild symptoms or no symptoms at all, are also going to give us a better sense. I mean, our challenge has been through all of this is that we don't really have a true number of cases, because there are a lot of individuals who we have not been able to test, and we have not been able to sort of do the testing the way we want to because of the limits. And so I think we don't really have a solid answer on that. It's going to be something that we'll get more information on as we run the testing and that.
Yeah. So those transplant recipients should really just kind of try to be patient and, you know, work with their provider as information becomes available over the next few months. So you mentioned testing a little bit, and I'm seeing a few people commenting or questioning that they maybe had mild symptoms, or they're worried that they have some symptoms, and should they get tested, and can they get tested?
So that is also a little location dependent still right now, but the hope is as more of these testing becomes available, as more of these sites become available, that we're actually starting to do more testing of these milder symptoms. When we were very limited in especially certain areas of the country, it really individuals only if they were getting hospitalized, or the sickest of the sick, or frontline healthcare workers, sort of, you know, incorporating more of other individuals. So, you know, checking in with their physician, kind of seeing what the local practice is, or what's the local availability for that testing. The other piece will also be, as I said, the antibody testing, once that starts to get ramped up, to sort of go back and look at those individuals who maybe had milder symptoms that we couldn't test right at that time. Now it's 3 or 4 weeks later. Should we check them and see? And then that would give us that sense of really how many people truly were affected by it.
Yeah, it's such a challenge. So a question from Scott here on the webinar is if he's someone who lives alone in an apartment but would be interested in doing home dialysis, can you talk about what that process looks like? Does someone come into their home, or do they learn to do that on their own? How does that work? And is that different now with COVID-19?
Well, that process is not, the process of training and all of that is not too different in this COVID-19 part. The training is actually still happening at a training center, because you do need that sort of one-on-one time with the nurse to kind of learn how to do the setup and that. So initially it starts off as an evaluation to kind of see if somebody is a good candidate for the home dialysis. Most people are, but there might be some different health conditions or maybe some different restrictions in terms of dialysis access, things like along that line. Once they're deemed to be a home candidate, they would start training at a home center. And once their training for home hemodialysis could be on the order of 4 to 6 weeks. For peritoneal dialysis, it could be on the order of 2 to 4 weeks. Everybody is different. They're not having you leave training before you're ready to leave training. Once that training is completed, then you'll go home with the equipment and then you'll be doing those treatments.
Okay, thank you. That's helpful for people to know. I think even outside of COVID-19, I know a lot of people don't really, they might have questions about how home dialysis works. So that was really helpful to hear. Could you talk specifically, if there's information available? Sarah on Facebook is asking specifically how the virus COVID-19 affects your kidneys. Like, are there any specific attacks or effects on your kidneys from the virus?
As we're looking at individuals who have been exposed to COVID-19 and who've had it, it's primarily a respiratory illness. As they go through, as their body is going through those intense fevers, that respiratory illness, all of the blood pressure changes, all that, there can be changes in the kidney function, almost like a shock or an acute kidney injury. And in those settings, people may need temporary dialysis support. Now, whether or not they recuperate from their kidney function is a little bit dependent on what their underlying kidney function was beforehand. If someone had fairly normal kidney function, they have a much better chance of recovering from an acute kidney injury. Somebody with advanced kidney disease, that may be the thing that tips them over into ending up with that. In terms of, are there other injuries that are happening to the kidneys? That is, information is sort of being collected as we go through this experience, and we're at some of the biopsy results that are coming from different institutions, and there's been a lot of sharing of information between the healthcare institutions in terms of what they're seeing, what works, what doesn't work.
Thank you. That's really helpful information. Another question that we just got on the webinar is, and this was actually asked a couple weeks ago, but I think it's good to touch on again. What about living kidney donors? Do they face any additional risks as far as getting COVID-19?
No, we don't see anything that would put them at additional risk, after donating a kidney or anything like that. Because, remember, these individuals are fairly healthy. They're not going on suppressive therapy. So there's not anything that stands out as an increased risk for them.
That's good to know. A question also on the webinar is about washing groceries or things that are coming into the home from the outside. Do you want to talk about that a little bit, if that's a recommendation for transplant patients or any kidney patient, and how they might do that?
And it's actually somewhat of a recommendation for all of us. I mean, so the virus is spread through respiratory droplets. And so if, say, someone sneezes, coughs, doesn't wash their hands, and then handles groceries or things like that, there is a potential for the virus to be on that surface of those containers or produce or things along that line. So the recommendations are, when you bring those items into your home, you kind of wipe them down, you are washing your produce, and then you make sure you wash your hands after you handle all of those items that have been from the outside that you're bringing into your home, before you touch your face or your mouth. Some of the big spread is the virus particle is on something, you handle that, and then inherently we are by nature all people who tend to touch our eyes, face a lot. And that's how you potentially can spread or infect yourself from that. And so those are what those guidelines are. So like when people are getting takeout, You get, throw out the bags from the takeout, you throw out the containers, and then wash your hands before you start eating or touching your face or anything along those lines.
Yeah, that's really helpful because just the virus, being on surfaces is, it's hard to remember to keep washing your hands and not touch your face. So that's helpful to remind ourselves. A question from Laurel on Facebook is about people who are passing away from COVID-19, and are their kidneys viable for transplant?
So if COVID-19 is detected, if then any of those viral particles are detected in the kidneys, those are not usable kidneys because that's a reservoir of infection. And then we to another, we put it into recipient. When they're getting all this immunosuppression, going to flare up that infection. So right now, somebody who's passing away from COVID-19, most likely we're not using their organs.
That makes sense. Sorry, I'm just scrolling through to see if there's other questions. A couple of people have asked about going in for like blood work appointments or other doctor's appointments. Do you have recommendations on how they can, protect themselves? Should they reschedule these appointments?
I think it's going to be on a case-by-case kind of area. If there have been recent issues, so say you're having some challenges with your blood pressure or leg swelling, something along those lines where there might be some adjustments in medication, your physician might ask you to go ahead and get some lab work because they're trying to balance you going to the lab and potentially having an exposure that way versus not managing something and you getting sick from that and then needing to go to the hospital. And so that's always the question that we're kind of looking at. Am I putting them at more risk, or is it more risky for them not to have that lab work? If somebody has had stable kidney function, things have been otherwise going fine, there haven't been any recent changes, a lot of us are pushing the labs off for a little bit longer. So really, it's important to discuss that with your primary care doctor or nephrologist to see what's the best treatment option. Because our goal is, as much as possible, knowing that the hospital's systems are overwhelmed with COVID-19 patients coming, we want to keep people out of the hospital as much as possible. So if it's a matter of we delaying something and then you ending up in the hospital from completely unrelated COVID-19 thing, we haven't really helped you. So it's important to have that discussion with your doctor. And literally, that's probably about 25 of the emails I get every day right now from and then it's sort of like, no, you can wait until this time. You can wait until this time, or we've had a lot of changes. We need to get this done. And when you go to the lab, a lot of labs are requesting that you make appointments. You go in, you're wearing a mask, you practice hand hygiene, you get your lab work done. And then when you go home, change out of those outdoor, those clothes, and then make sure you're practicing good hand hygiene.
Got it. I'm starting to hear sort of similarities in the recommendations: washing your hands a lot, wearing a mask when you're outdoors, changing out of your outdoor clothes when you come home. All those precautions seem to be similar for a lot of different cases. That's really helpful. Kind of a related question, but how often per day is it recommended to wash your hands, and how long to wash your hands for?
So for washing your hands, you want to do that for at least 20 seconds. And when you're washing your hands, you want to make sure you wash the back of your hands and wash your thumbs. That's one of the things, like when people are quickly washing their hands, I'll see them miss those pieces. Really about when you have any contact with any items that have been outside the home, if you're outdoors, touching different things like the shopping cart, things like that. Those are the things. There's no specific thing to say you have to wash your hands 10 times a day, 20 times a day. It's really depending on what's happening with your exposure.
Got it. That makes sense. So we're seeing a few questions on Facebook from patients regarding outcomes and survival statistics for both transplant and dialysis patients around COVID-19. Can you touch on any of the data that's coming out, or is it too early to know these things?
I think I really couldn't touch on the specific data in terms of percentages and that. So The overall percentage of mortality is about 1%, 2%, but in terms of specifics about dialysis patients and that, because it's also a balance of what other health conditions might have, somebody who's on dialysis who maybe has just high blood pressure might be in a very different scenario versus somebody who's on dialysis who maybe has underlying lung disease or underlying history of cancer. So it's hard to kind of tease out that number.
Yeah.
And I don't really have that number at this point.
Yeah, I imagine it will be a long time before we are really digging into the statistics and able to make these sorts of generalizations, because this is all so new still. So I apologize, there's definitely still questions that we haven't gotten a chance to answer, but I want to be cognizant of our time. How about one more question about, can you talk at all, a few people have questions about shortages of medications for either transplant patients or other patients. Can you talk at all about that and maybe what's being done or what patients can do to ensure that they have access to their medications?
So some of the shortages that we might be seeing might be a little bit of an issue of sort of the supply chain. Areas where we were potentially getting medications from, we may not be getting them to. And I know different pharmacies, healthcare institutions are working to look at alternative suppliers to kind of help with that. You might see some recommendations to sort of switch certain medications if they are within the same family. And, for things like certain blood pressure medications, things along that line, that may be an acceptable kind of route. The other potential shortage that we have seen, and that's partially because of some question as to whether or not about using the hydroxychloroquine as a treatment. We've been hearing from individuals who are on the medication, people with autoimmune disorders such as lupus, who are routinely on that medication having a harder time kind of trying to find it. And so, if we're all kind of mindful of the fact that these are not yet proven advocated treatments, that people can be self-treating with that, those are, that may help us from that standpoint. There might be some situations where we have to go to an alternative pharmacy or kind of working with that. And so, working with your doctor's office to kind of help kind of coordinate some of those different, trying to maintain those different supplies of medications.
Got it. That makes sense. Well, I really want to thank you, Dr. Thavarajah, for joining us today and for answering all these questions. To all our viewers, if we didn't get to your question, we will get back to you directly in the comments, or for those of you on the webinar, we'll try to get back to you via email. But thank you all for watching and for joining us. And just a reminder to visit our website, kidney.org. We have a whole coronavirus page up there with lots of articles and resources. And you can also catch up on our previous Facebook Live videos each week on our Facebook page and on our YouTube channel. So thank you, Dr. Thavarajah. And thanks everyone for watching, and have a great day.
Thank you. Thanks for having me. And thank you all to the dialysis teams that are helping things keep running. All right.